Yeah, we're talking to Maria Caulfield, who is a former Conservative MP, now a nurse, gone back to the NHS, actually, after leaving the bear pit that was Westminster. Maria, very good morning to you.
Good morning, Mike.
I suppose I really should start by asking you what you made of that Rachel Reeves situation yesterday. I mean, you've worked in Westminster, you've worked in pretty high-profile jobs in Parliament, and it is a pretty rough and tumble sort of place, I would imagine. What was your sort of first reaction to that?
Yeah, I mean, it's a brutal place, and if you do badly, it's, a public humiliation, really. But if someone was that upset, the whip should have said, look, you're not going into the chamber today, and, diffuse the situation that way. I felt very sorry for her. But, that's politics. It is a brutal, Liz Truss faced it, Theresa May faced it.
Yeah.
Politics do face this, and it's not been a great advert, but I felt deeply sorry for her.
It's difficult. It was a difficult thing to watch, wasn't it? You've gone back now into healthcare, which is, I think, where you came from. What made you decide to do that?
Well, the only reason I went into politics was because I joined a campaign to save my local hospital. So once I kind of wasn't an MP anymore, it made sense to go back. It's a great job being a nurse, and the hospital I work in is a pretty good one. So I'm very lucky. And
have you found any differences between how long were you away for, and what was it like when you went back?
So I was an MP for 10 years. I kept my registration, and I would be. I'd go back at weekends and nights to do some shifts to keep my registration. But right. The biggest thing is just the explosion in staff. Yeah. When the job that I was doing before, there's about 8 or 9 people now doing that job, and so I can see where the money's being spent. So there's a lot more bureaucracy than there was when I left the NHS.
Right. So are you saying so they've got more people, but not necessarily it's any more efficient then?
Yeah, definitely. And the systems around it, not, my hospital's a great hospital, but, if you're trying to get someone an appointment with a GP or, trying to speak to their community team, it's a very inefficient system, even as a healthcare professional, to try and get support for patients.
Right. Because, I mean, today we're going to speak to Wes Streeting shortly after we've spoken to you. He's going to be on the show, Secretary of State for Health. He's with the Prime Minister today launching the new 10-year health plan to bring the NHS supposedly closer to home. But one of the problems that I hear about all the time is people saying that they get appointments made and the appointments keep getting cancelled. We hear from Keir Starmer all the time that they've got 4 million more appointments now than they had this time last year. And it may well be that they're making the appointments, but there's an awful lot of people then having those appointments cancelled and they don't get to see anybody.
Yeah, and this is all about, trying to make sure the figures add up so they can say that they've offered appointments. Yeah. But for patients, when those appointments are cancelled, they're back on the waiting list. But for me, the real issue is most of our patients are very happy once they get into the system. Right. So once they're seen by hospitals, they get their tests done, they get their treatment. The real issue is getting into that system. And so the key crux that matter for me is that we've got to open up access to the NHS, so you're not having to necessarily go through your GP to try and get a referral or to try and get the first test. That, what Wes is announcing today is just really tinkering around the edges. We need, fundamental reform that we tried to start. We tried to get 7-day-a-week NHS going, but we ran into the BMA and the unions. Right. But if you do that, patients are still going to be stuck and having to go to A&E just to get basic treatment, which is absolutely not what the system was set up for.
No. And this morning, Wes Streeting is supposedly announcing this neighbourhood health centre scheme where, I don't know if you've seen this in the papers this morning, they want to have outpatient appointments, mental health therapy and a host of services outside of a hospital so that people don't need to go to a hospital, and they want to have thousands more GPs. Well, it seems to me that sounds very nice and lovely to do, but the reason whenever I speak to doctors that there aren't enough GPs, they say, is because there aren't enough GPs, period, in the country, and there aren't enough trained GPs, and there aren't enough people who can fill those vacancies.
Well, I'd be interested, Mike, if you ask Wes, that, the figures coming out from the BMA is that we instigated training more GPs and more nurses, but 6 out of 10 new GPs who are qualified can't actually get a job in a GP practice. Right. And why is that? Student nurses, the cohort that are qualifying in September, there are thousands around England that can't get a job because there's job freezes in NHS trusts. So where is the money being spent if it's not being spent on new GPs and new nurses? And we're spending the money, taxpayers have spent money to train these people, very highly skilled, very highly experienced people, and then they can't get a job. Right. So they're course they leave and we lose all those skills and training. So if they want to do this, all the money we've spent training those staff, they've got to employ them instead of some of these other roles that are in the NHS, which, you know, patients never get to see. You know, it's got to be clinical staff first.
Right. So from what you're saying, by the sounds of it, Maria, is that there's too many kind of admin staff in the NHS and not enough actual sort of front of house, proper medically trained staff. Is that what you're saying?
Yeah, I think, you know, managers make decisions about how that money is spent, and very often it's not spent on clinical staff, and that's part of the problem because, you know, it's great having, you know, team managers and all of these things, but patients need to see doctors, nurses, pharmacists, physios, and you know, that's the crux of the matter. If there's not enough of those people, Wes can want to dream up you know, all sorts of initiatives, weekend openings, evening openings, but unless you've got those staff, it's just not going to work. And of course, you know, Labour spent, you know, over 600 million on that 22% pay rise for junior doctors. So paying existing staff more, which, you know, as a nurse, I'm not complaining about a pay rise. But that money is then, you know, not available to take on the extra staff that we desperately need.
Yeah, and that is a problem. And I'm assuming, because I've been told this before, that the reason doctors can't find work as GPs is because the practices that would be hiring them normally can't afford them.
Yeah, and, you know, the thing is, as a minister and as a government, you don't have direct control over GPs. They are a private business who take on an NHS contract. So we give GPs a lot of money, but we have, you know, as a government or a minister, but you actually have no control over how they spend that. And so that makes it very difficult. It's the same with dentists. There's £3 billion a year spent on dentistry in England. It's not ring fenced. So if the local health authority, the ICB, choose not to spend it on dentistry, there's not a lot you can do about it as a government minister, and it means that patients then don't get dentistry appointments. So that's why it needs to be fundamental reform of the system rather than tinkering around the edges, which, you know, most patients think, well, that's just never going to happen. And unless you change that system and modify it and bring people like the BMA with you, then, you know, this time next year, you'll be in exactly the same position.
Yeah, that's the trouble. Maria, good to talk to you. Thanks very much indeed. We must do it more often. Maria Caulfield, a nurse and former Conservative MP, who's gone back into nursing and says, you know, what she's found is there's a lot more people working in her hospital that she's in than there were when she left 10 years ago. But it's actually less efficient.